Joining me now, Dr. Susie Hoda and Dr. Isaac Bogosh, both infectious disease specialists at the University Health Network, and both joining us from outside the studio as we continue to practice good social distancing. Hello to the two of you. Dr. Bogosh, let's get started with question one. This is one that we've actually gotten a fair bit. Does the kind of soap I use to wash my hands matter?
The short answer to that is no. Any soap should do, and if soap isn't available, hand sanitizer with at least 60% alcohol should suffice.
Any soap should do, and does it matter if it's a bar soap or soap out of a bottle, like a plunger?
It really doesn't matter. It really doesn't matter. Soap is soap is soap. It'll work. It's effective. And again, I think the key thing here is hand hygiene. So if it isn't available, but someone has hand sanitizer, that's fantastic as long as there's at least 60% alcohol in the hand sanitizer.
All right, good point. Question number two to Dr. Hoda. Does practicing social distancing effectively mean self-isolation, staying at home?
It's not exactly the same thing. I mean, both of those things are trying to aim at achieving the same thing, which is trying to prevent people from being in close contact so that, you don't have transmission of the virus. But social distancing is really just trying to keep your distance from people, but you're able to leave the home and do certain things, whereas self-isolation means you stay within the home. You really limit the number of people within your household that are even going to be in contact with you in the same room, and you're careful about things like sharing items in the house. Okay,
Dr. Bogosh, third question, a bit along similar lines. Is it safe to travel within Canada to spend time with, say, family?
In general, I think that really kind of goes against the principles of what we're really trying to achieve here. And of course, I appreciate that some people have to travel. There might be a sick relative or something that's really urgent that someone has to go to. But in general, it's really time to stay home. It's really time for social distancing measures to be implemented widely. And traveling, even within Canada, kind of goes against that.
And so if you travel interprovincially, when you come back, should you self-isolate in the same way that you're supposed to when you come back from out of the country?
No, not yet. Those measures have not been taken just yet. I don't know if we'll get there, but certainly that's not the case right now.
Okay, Dr. Hoda, this is one I've seen a lot online. Do anti-inflammatories really make you more susceptible to the virus? So we're talking things like Advil, ibuprofen.
I don't think we really know an answer to that at this point in time. We're not giving advice for people to avoid taking those medications, although there are some questions about, whether or not that might affect your outcome. I'd wait for some more data to come out.
Yeah, Dr. Bogosh, I mean, that is something we've seen circulating online, though. I mean, where did that come from?
I think there was a French official that had raised this point, and then it kind of took off from there, but we really don't have any data to support this one way or another.
Okay, last question, I want to go to you. How much worse is this going to get?
Sadly, we know it's going to get worse. And certainly day by day, we're going to see more and more cases. However, it is truly up to us to see how we can mitigate this. And if we really all roll up our collective sleeves, practice social distancing, which means a lot of things like working from home and really staying apart from one another, we can really ensure that this doesn't get too bad.
And Dr. Hoda, I'd like you to take on that same question. How much worse do you think this is going to get?
I completely agree. I think we're going to see more people get sick from COVID-19. I think we were expecting that. We're trying to prepare to deal with that by using these interventions like social distancing to try and help the system cope with it.
Dr. Hoda, Dr. Bogosh, good to have you on. Thanks.
Thank you.